There's too much at stake to take shortcuts. We must follow the science and put safety ahead of, well, everything. At Pfizer, we've been making safe and effective medicines for more than 170 years. Following rigorous standards, we will not compromise them in the interest of speed. The same applies today as we develop a potential vaccine for COVID-19. Because the way we see it, the only vaccine that works for your family is also the one that works for our own.
COVID-19 pandemic and antimicrobial resistance spread, we do see some similarities. But unlike COVID-19, AMR is a threat which we saw coming for a long time. COVID-19 probably will bring the focus back onto dealing with infectious diseases much more seriously across the world. And Pfizer has been very focused in wanting to combat it and build capabilities within ourselves and also with multiple stakeholders to be able to do that. I think the speed and responsiveness which we have shown today and wanting to invest heavily in finding innovative ways to deal with the pandemic is phenomenal. Do we see the same level of urgency and need to deal with the rapid spread of AMR? We have 700,000 deaths because of AMR, and the predictions and the modeling says that it could be as close as 10 million deaths by 2050. I think the time to act now and invest both in anti-infectives and also, more importantly, in vaccines is equally critical. The industry and Pfizer got much more focused and much more diligent in looking at supply capabilities, not just of medicines which are relevant for COVID pandemic management, but also medicines which are relevant for managing our public health in the other ways. Pfizer has about 40 manufacturing sites all over the world. And fortunately, despite the pandemic, they were all operational with minimal disruptions. The vaccine candidate for COVID-19 was found to be more than 90% effective in participants who had no evidence of prior SARS-CoV-2 infection. This means that we're one step closer to potentially providing people all over the world much needed breakthrough tackling with the pandemic and possibly even end the pandemic.